I want to say something before I start the presentation. I usually give a lot of the scientific and the technical presentations, and I'm really happy today to give a different topic, health and safety, because to me, it is a very important topic because it relates to the employee, and a happy work environment means a healthy employee and a healthy employer. And it only can lead for us to be more quality laboratory compliant, and then also will lead to employee satisfaction. We cannot do it any better unless we provide a health and safe environment for everyone to work and a happy environment. So it's usually health and safety can be, sometimes people feel it's a dry, topic. We know it, but really if you think about it from how we can be safe and be happy in our work environment, I think it's just going to put a smile on our face, and we can do that presentation. As Marilyn said, and thank you for your introduction, Marilyn, it is an important topic because we all are required to have 1 hour of health and safety training. So that will meet the requirement for us, and we actually do it in our institute, not only for getting recertified or getting a license, but we do it for all the employees, and not only once a year. Actually, every general lab meeting we attend, we talk about health and safety in every segment. So having said that, the agenda will cover the regulatory agencies that govern health and safety. Statistics, I wanted to share with you some of the numbers so it all kind of sink in for us. Bloodborne pathogens, we always talk about that as part of the training. Chemical hygiene plan and chemical hygiene in the laboratory. And most importantly, especially in our field, ergonomics. So why should we care about safety? It is the law. As you all know, OSHA, federal government, help us to put the regulations and the guidelines so we can follow. State regulations, accreditation. Now on the CAP checklist, you see a lot of questions about health and safety. It can be a financial burden on our workplace if we have an injury in the workplace. Employees, first of all, get injured. And then secondly, we can have missed work and missed work days. And most importantly, it's the moral, and it's the right thing to do. So we're going to start with CMS. Again, CMS, the Center of Medicare and Medicaid Services, actually regulates all the laboratory testing, and also that is very important, and it works through CLIA. Also, OSHA, the Occupational Safety and Health Administration, is one of the rule makers for the laboratory. And then CAP, as I said, which is approved accredited organization under the CLIA. And we'll talk about that a little bit and what CAP tell us to do. So we're going to start with the OSH, which is the Occupational Safety and Health Act. In 1970, it was formed. And it wanted to assure for us a safe and healthy work environment with conditions for every man and woman that works in a workplace, and then also authorizes enforcement of the standards developed under that act. So OSHA have a comprehensive approach, but it comprises of 4 elements. First, they provide the guidelines for us, and the guidelines is around preventing and reducing the workplace ergonomic injuries, and also the musculoskeletal disorders, MSD. It also helps us to enforce it, and that there are a lot of clauses in the act which make sure that we keep the workplace safe and free of any hazards, serious hazards that can injure or cause ergonomic hazards to our employees. In addition to that, it provides guidance and training for us, tools. And then finally, it invests in research in order to be able to encourage researchers to look at more whether ergonomics or health and safety tools for us in the workplace. So I wanted to talk about OSHA reportable a little bit. What is an OSHA reportable? An OSHA reportable is an injury which is work-related, And it's more than first aid. Usually people will seek medical help, and also could be also medication will be given to the employee at that time. So in any workplace, our ergonomic goal is to reduce injuries, right, and illnesses. But also in the Act of 1970, it also required all the private sector, the employers, to prepare and maintain all records that is work-related injuries or any illnesses that happen on the job. So it requires us to do that. There are forms that we have to fill out, and we have to counsel the employer and then also the employee, and also put corrective action in place. So there are two paragraphs that I wanted to stress on under the OSH Act. It's the paragraph 5A, which is more targeted towards the employer. And it does say that we have to furnish a place of employment which is free from recognized hazards that are likely that can cause death or a serious physical harm to the employees. And on the other side, we have also another paragraph, which is 5B, which expects that the employee can comply with all the standard operating procedures and any policies that the employer has in the workplace. So it is a two-way communication, and it's a responsibility that is on the employer and the employee also. You know, the employee can set a lot of guidelines for us, but if we are employees not following the guidelines and the policies, it's not going to be an effective plan. Also, there is Title 29 code, and under federal regulations, there are several other policies that include chemical hygiene, hazard communication, bloodborne pathogen, personal protective equipment in the workplace, and then emergency action and fire prevention program. And I know as we sit here, every laboratory has a lot of these plans in the health and safety manual. But again, that's just to also comply with the federal regulations. Wanted to stress a little bit on the CAP, because as we all prepare for the CAP checklist, we have the general CAP checklist, and the general CAP checklist has a lot, if you read, you know, a lot of areas where we really have to be watching for all the health and safety in the laboratory. So the first one, it asks, the cytogenetics laboratory is in compliance with all safety requirements as identified in the laboratory general checklist. And then when you go to the general checklist, there are several categories. Are safety procedures posted or readily available to all personnel? So when you do the check, you know, as you are preparing for the CAP checklist, make sure you have an SOP, it's being communicated to the employees, and you all are following and reading all your SOPs. Is there a documentation, at least annual review of the safety policies and procedures by the current laboratory director or designee? So the laboratory director has to sign off that we have the annual review of our policies in the laboratory. Have the policies and procedures been developed regarding the reporting of all occupational injuries and illness that require medical treatment except first aid? So again, they can review all the incident reports that you are filing, look at the corrective action, make sure that we have put action plans in place to avoid this injury, and also, you know, put the CAPA in place. So it's not only a corrective action, but you also have to put a preventative action so it doesn't happen to another employee or happen to yourself. Has an evaluation of their occupational injury illness reports been incorporated in the lab quality management program to avoid recurrence? As I mentioned, this is, you know, the CAPA, you know, the corrective action and the preventative action. Are fire drills conducted at least annually? So I want to make sure that we are providing the fire, you know, drills. You know, you have to do that annually. You have to keep an attendance record of that, and you have to cover all shifts. If you have people working AM, PM shift, everyone has to go through the fire drill and know what are the exits to, you know, from their building, from your department, and so forth. Have personnel instructed in the use of portable fire extinguishers? Again, part of the annual training, we do training on the fire extinguishers, their types, and how can you work a fire extinguisher, and what type of fire extinguishers are out there. And we'll touch bases on that, will be part of your training this year. Does the lab have a chemical hygiene plan that defines the safety procedures for all chemicals used in the laboratory? And we'll talk about that as part of our plan today, is the chemical hygiene plan. So again, you could see CAP all over the place in the general checklist, talk about health and safety here. Again, is there a program to reduce the volume of hazardous waste that is generated by the laboratory? I mean, I'm sure we create a lot of it. And then, is there a documented ergonomic program to prevent MSD in the workplace through prevention and engineering controls? And not only that, it also, under the commentary, if you read under the commentary on the CAP checklist, it also describes in detail what type of elements you want to have in your program and in your SOPs. For example, assessment activities to identify physical work activities. It talks about the workplace, the equipment, the chairs, the laboratory workstation, the computer keyboards. I mean, it really identifies in details what other areas you want to tackle beside, you know, just the major issues. There are a lot of other resources beside the OSHA and the CAP. I mean, you can, you know, I've listed a few of them here. Later on in the presentation, I'm going to talk about the Environmental Protection Agency also. But again, there are the CDC, which you all know about, the Center of Disease Control and Prevention, and there are a lot of other agencies here. So again, you can always go to the website, and if you have a question about something, you can always read and get more information there. Wanted to talk about statistics because for me, the numbers stick in my mind and are more effective to me when I know percentages and, you know, what is the percent of an injury and so forth. So I always like, you know, to put some of those in there. So again, the Bureau of the Labor Statistics of the US have provided some numbers through annual surveys. And for example, in 2008, it does indicate that there was $48.6 billion were spent on worker compensation. Ergonomic injuries was one of the categories. And if you look at the ergonomic injuries, it comprised more than half of the US disabling occupational injury burdens. So, which, you know, if you maybe look at any workplace, definitely ergonomics is the majority of that, especially if you, you know, with labor-intensive tests and so forth, you know, ergonomics becomes an issue. So for ergonomic-related injuries, it's estimated 30.9 billion or 63.6% of the injuries are ergonomic-related. That's only direct cost. If you put indirect cost to that, you can multiply that by 2 to 5 times, and that can cost anywhere between 60 billion to 150 billion. Out of the ergonomic-related injuries, the top one out of the ergonomic-related category is the overexertion. What does that mean? It means the lifting, the pushing, the pulling, the holding, the carrying, and the throwing, and that's 25.7%. Falls is on the same level, and we'll talk about that a little bit. That's 13.3%. Falls to a lower level is ranked third at 10.8%. So, and then if you look at other categories, which is bodily reaction, what does that mean? Bending, climbing, slipping, tripping, and falling, that's at 10%. Struck by an object, that's 8.9%, and maybe what does it mean, struck by object? I mean, I'll give you an example. A courier getting into the car, bumped into the car, you know, as the person is getting in, it's struck by an object, okay? And it happens, you know, just getting in your car, you could, you know, injure your head. Other things like ergonomic bodily reaction, as I said, you may be losing your balance, you're slipping, you're tripping, and that can cause also a bodily reaction and an ergonomic related injury. One of the things I always, you know, when we do the training, we tell the employees is that you're not only looking for the safety of yourself, but you're also looking for the safety of the person next to you, because any act on my behalf, if I do, I might pass an injury and I don't get injured, but maybe the person next to me can get injured. And I'll give you an example, and that happened in front of my eyes. You know, an employee was slipped and, you know, tripped and was gonna fall, but this person also trying to catch on something took the person next to her, and both got injured, both fell down. So, leaning on a person, you're trying, of course, you try, but, we got 2 people injured at the same time because, trying to help a person. So, I always feel you're not only responsible for your safety, but you're also responsible for the safety of others. Even when it comes to reporting an injury, or reporting something, it is our responsibility to report something. A lot of times, when I walk around the labs, I see a box, and all what I do is I walk around the box and say, hey, I did it, I didn't fall. But, I don't take care of the box and take it and put it on top of a table or discard it. So if I was saved, maybe the other person next to me is not going to be saved. And we always talk about, how the technology maybe sometimes is harming us, because here we are texting, we're on a break, we're going down, the stairway, and we're texting, and you're not watching really your steps and so forth. So a lot of things can be happening to us because of the technology, and we're just not really, paying attention to everything that we should. Struck against an object, 5.1%. Highway incidents, 4.9%. Caught in or compressed by, 4.4%. Repetitive motion, 4%. And assault and violent acts, thank God, that is 0.9% only. So, okay. So again, if we look at the data between 1998 and 2008, the good news is the ergonomic injuries is going down. And if you think about it, why? Because there are a lot of automation and a lot of solutions. We now know to do ergonomic assessment. We're aware about how we sit upright. A lot of knowledge has been given to us since 1998 that improved our ergonomic awareness and not us hurting ourselves. But on the other side, when you look at the same, on the same level, falls at a lower level increased, and then also struck against an object also increased. So when you think about that, what could be related to that? And of course, there could be a lot of good reasons that, as I said, technology, maybe, we're not paying attention as much, we're busier, working, more efficiently, that a lot of things we're not paying attention to, a lot of things. But, to me, I feel those are within our control and we can correct them, in my opinion, so. Okay, so, however, the repetitive motion, people that have that, or, we got injured, has the longest exposure. The median is 19 days, a person will be out of work. And then the next longest median absence in days was due to falls to a lower level, and that's 10 days. Okay, I'm gonna switch gears. So we talked about the regulatory agencies. We did talk about some of the statistics. Now we're gonna talk about one of the most important aspects of health and safety, which is the bloodborne pathogen exposure control plan. Okay, so that was developed in the late 1980s. It applies to blood, but also applies for other potentially infectious substances, OPIM. Okay, so when you see that abbreviation, it's all the other body fluids, right? Allow classification of employees based on exposure risk, and we're gonna talk about that, the categories of that. So what is the other potentially material that, any body fluids, we listed quite a few of them, but anything that's contaminated with blood or other body fluids. So honestly, we all say that when you are working in the laboratory, you have to treat everything as potentially infectious, right, material. So an employee who, as a result of their normal work activities, is exposed to blood or other potential material, regardless of the use of protective equipment to prevent actual contact. So really, it really doesn't matter. You have to always be careful when you handle any of those body fluids. Exposure event is when a blood or any other body fluids actually contact an employee's skin, hair, mucous membranes. So that is considered an exposure. So there are several categories. Category 1 is when you're working in the laboratory and you are exposed to all the body fluids in the blood. Category 2 is when no occupational exposure, but your job duties may require that you go and step and be working around the bloods and other body fluids. So for example, a lab admin, they might be taking paperwork back and forth into the laboratory, so they are a category 2. Category 3 is mainly maybe you really are not exposed, you don't go to those areas, maybe you work in QA or you work in other areas where you are not working around those body fluids and the blood. The reason why you want to be identified to the categories, because even when you do the health and safety annual training, if you're a category 3 or an office person, you get a different kind of training than when you work in the laboratory. For example, in our environment, any admin person that work and does not handle any body fluids or all that, we don't give them certain training, and our training in the laboratory for these people are only confined to half an hour. However, all the laboratorians that work in the lab, those get 1 hour of training. So that's an example. Okay, universal precautions. As I said, you have to assume that blood and body fluids of any patient is infectious. If you put that in mind, you're always going to wear your protective equipment. You're going to take extra precautions when you are handling these. Recommend that you wear your protective equipment and any other infectious control practices to prevent transmission, and we'll talk about that a little bit down the line. And then a decision about the protective equipment is usually determined by the type of clinical operation. So we'll talk. If you're working with TB, for example, tuberculosis, you're going to have totally different protective equipment that you need to wear. Expanded precautions include contact precautions, droplet precautions, airborne infection isolation, and then additional protective equipment requirement. So what does that mean? Okay. And then engineering controls, the pipette, the filters, the tips, the plastic tips, safety devices or needles, and then administrative controls. Only trained employees can do the work. We'll talk about the Hep B, the hepatitis B vaccination, which we offer, and then the timely medication intervention when required. Okay, so for the work practices, we know that no eating, drinking, or applying cosmetics in the lab is allowed. You use engineering controls, you avoid any contact with sharps, you wash your hands. It's a good practice before you go into the lab and after, before you get out of the lab, and then you disinfect your work surfaces. And as we all know, we actually have, decontamination sheets that we have to do that on a daily basis, and we sign off and initial on those, and we keep those as a document when we get inspected. And then again, the protective equipment that you have to wear, it varies from glove, lab coats, face shields, and respirators. So really, hepatitis B vaccination. It is a recommendation that it is a standing offer for category 1 and 2 workers that we offer them hepatitis B vaccination. It is a totally voluntary participation, okay? But the employer has to offer it, whether you take it or not, but the employer has to do that. In our facility, and I don't know, we offer it free to employees. We try to provide reasonable time and place for the employees and encourage them to go and take the Hep B vaccination. We have a form where we document the acceptance and the decline, and then we track the vaccination status, okay, because you get the booster also, and we want to be able to send a reminder, you need to go. So medical intervention. Employees have the right for medical consultation after an exposure event. Of course, you want to offer that. We can offer a baseline and a post-exposure serological testing is recommended. The medical director shall attempt to confirm the source and the patient infectious status. We are allowed to call, and it's totally confidential to find out if someone has an exposure. If the patient has, a certain disease that we need to test for, and keep the employee informed about that. And then ways that we can protect ourselves. As I said, using engineering controls, follow the standard operating procedure, and use the protective equipment and that's provided to us. So what is the personal protective equipment that you want to wear? The definition is specialized clothing or equipment worn by an employee for protective against a hazard. Okay, OSHA also specifies the circumstances where you need to wear protective equipment. Employees must provide the protective equipment to all employees. We also need to provide a single use of the protective equipment and then discard it after that appropriately. But also if we have a reusable protective equipment like lab coats, we can send them to laundry and they come back. We just need to make sure that they're laundered correctly, they are repaired and stored in the correct areas after use and so forth. And then also CDC recommends when and what and how we use our protective equipment. Okay. So what are the factors that influence what to wear and what to do? Type of exposures anticipated. If there's a splash spray versus a touch, the durability of our protective equipment, and then the appropriate for the task, and then the fitting, which I'm going to talk about how you fit also the protective equipment. So again, gloves, we know, gowns or aprons, face shields, to protect the face, mouth, nose, and eyes, and the mucal membranes, goggles to protect your eyes. Not only your eye, your reading glasses or your eyeglasses is enough. You need to wear the goggles, and then mask and respirators. As I said, TB areas, we have to really fit the respirator to each person, and that can take weeks. So these employees cannot work in these sections until they have passed the fitting and everything works well. Okay, so what is the sequence of when you wear protective equipment even, they tell us how to wear it. You have to wear your gown first, then wear your mask or respirator, the goggles or the face shield, and then the last thing you want to wear is the gloves. And of course, we know the gloves, we're just not wearing them just to cover from here. It has to really cover all your hands. So you need to make sure that you have your lab coat tightened, and then your sleeve, and then you put your gloves over your sleeves, because you would see sometimes injuries is because there was part of the skin that was exposed, and you never know if you have a spill, it might just come to that area. Okay, so the key points for protective equipment done before starting any work, before touching any equipment. And as you all know, we face the dilemma that we have a computer, we are wearing, a glove where it could be contaminated. We go to the computer and the keyboard and work on the computer and keyboard with the gloves, or we go out of the lab and, hold the door handle with the gloves. I mean, all those things we have to be very careful with. We cannot do that. The gloves has to be removed before you use the computer, because another admin can come and use the computer and we don't know what is on the gloves, and the same with the doorknobs and the door handles. So you need to use carefully and do not spread contamination. Remove and discard carefully, and then wash hands and the forearms immediately upon removal of your gloves with disinfected soaps. Again, talking about the gloves, there are totally different types of gloves. The only thing is the vinyl gloves. These are patient samples, but they're not very strong enough to handle any strong reagents. And there are totally different types of gloves, and I know that we're offered those, and the different ones. Okay, so what's the do's and do not do's with the gloves? As I mentioned, you want to watch out for the touch contamination. Change the gloves often if it's torn or soiled, and then also never wash or reuse the disposable gloves. These are actually the chem wipes and the disinfectants, and the gloves are the cheapest supplies that we have in the laboratory. Gowns and aprons protect skin and clothing, single use or reusable, and then resistant to fluid penetration, and then clean or sterile. Face shields, this is very important. You need to protect your forehead, below the chin, around and the side of the face, and then consider poisoning with respect to the hazard. This is a positioning, I'm sorry, not poisoning, sorry about that. Okay. This is very important. You see sometimes staff wear the face shields that are hanging like that, and that's okay if the hazards are under. But if you have stuff on top of the shelf, you have reagents on top of the shelf, be careful to make sure that, sometimes the injuries is because you're protecting this side, but you're not protecting from upwards. So you have to make sure that you're wearing the face shields correctly and positioned to where your hazard material is. Mask is to protect the nose and the mouth, and then the safety glasses and goggles is to protect the eyes. Okay, as I said, the fitting is very important. The training and the medical authorization for the respiratory protection program and the masks are very important in the laboratory for those who's handling the TB. Surface decontamination, there are a lot of disinfectants, and some are powerful than others when it comes to certain areas. I mentioned the EPA, which is the Environmental Protection Agency. Actually, they have some guidelines of what kind of disinfectant to use. So this list will show you what kind of disinfectants are being used. You might use one for HIV, a different one for HPV, HCV, and MRSA. I mean, they all have different more powerful disinfectants than others. Okay, so that takes us now to the chemical hygiene plan. So we talked about the bloodborne pathogens, and we know what they are. Now we're going to talk about the chemical hygiene plan. So what is the chemical hygiene plan? This is to protect employees from exposure to hazardous laboratory chemicals. So what does that mean? There could be physical hazards, there could be health hazards, and then there also could be carcinogens, reproductive toxicants, and then also high degree of acute or chronic toxicity in the stuff that we handle and we do in the laboratory. So for the physical hazards, what does that mean? Compressed gases, corrosives, flammables, cryogen, reactive, and water reactive. These could be all presented as physical hazards for us in the workplace. Health hazards, again, carcinogen, mutagen, even allergens, corrosive synthesizers, and then others, other toxic. So the National Toxicology Program provides us with what is the human carcinogen that are known. And also, what is the reasonably anticipated to be a carcinogen? As you all know, we work with the laboratory and we have certain few things in the cytogenetics that we mark carcinogens. And we put that label on there to make sure that the staff is aware that this is a carcinogen when they're handling those chemicals. There's a group 1 carcinogen, group 2, A and B, also carcinogens. And there are reproductive toxicants. What does that mean? That means that they affect the reproductive capabilities in the males and females if you use those certain mutagens and teratogens. And then also there are acute or chronic highly toxic chemicals that are being used. And not to mention also if you're also handling some radioactive materials in your laboratory. So how can that happen? Okay, how can we get exposed to that? We can get exposed through inhalation, dermal through our skin, injection through a cut or a wound, and then also through ingestion, eating, and drinking. And there are different forms. There could be acute or chronic effects on the body, or they could be also systemic or even local effects. So exposure determination. What is very important that we know the properties of the material. We always have a process review to know what we're dealing with. Emergency evaluation if there's an exposure. Control methods so we don't get exposed. And then modeling and direct sampling of these. And we'll talk about these also. So for example, if there is an exposure, medical consultation should be provided at no cost to the employees. We need to understand what the signs and the symptoms when the exposure happened to the chemicals. We need to be able to know an action level or what is required by law when there's an exposure. And then after emergency event like chemical spills, we need to have a plan to be dealing with that and train our employees on those. So for example, for the basic requirement, you at least have to have a written program identifying those chemical exposures and the hazard in the workplace. Again, identify them, you list them in your SOP. You need to talk about how you're going to label them and have a label system to those become very apparent to everyone in the laboratory. And most importantly, you have to have the material safety data sheet, which is the MSDS, and we'll talk about that. A chemical list of everything that you use in the laboratory, and then employee information and training when you have all these in place. The chemical supplier actually provide us with a lot of these. They provide us with the MSDS sheets. Actually, we can go online and be able to get that. And then also, they ship only properly labeled containers for us. In addition to that, we also do that in the lab, and we'll talk about that. The employer must again maintain the MSDS, must maintain an accurate chemical checklist, assure that all containers have proper labeling, and provide training to all employees. So again, it's responsibility of both the employee and the employer. The employee must be familiar with the hazard of their job, must know how to protect themselves, must label all the containers properly, and must seek information or guidance when there are questions. So labels, again, for every hazard material that's received in the laboratory, it has to be marked. For example, hazard warning statements need to be done on the flammable, the corrosive, the reactive, and the toxic. And we have different labeling that we're going to show. The labels has to be legible. They have to be prominently displayed on the container, accurately reflect all the contents, and only change the label if the content of the container change. And you know, this always can be a challenge. You all have the big drums where we pour the methanol, the acetic acid, and all that. But you have to have big labels there telling the percentage of each thing that you're pouring in them. And you have to make sure that they're within acceptable limits. I mean, a lot of times if you put acid with, a base and all that stuff, you never know. I mean, this can bubble and can cause fumes and can do a lot of things. So you really need to be aware, what are you putting in there when you are using several different mixes of reagents in your drums and on your hazard waste. Also, big signs can be identifying the areas where there are similar hazard materials are stored. Portable containers need not to be labeled. I mean, if it's an empty container that you just take it to carry a methanol bottle from one area to another, that is fine. It's an empty container to use it for double protection. But anything else that has reagents has to be labeled. Okay, so you're all familiar with all this labeling, right? You know, we use them. We have the signs that we put them in work areas. And then also we have all the other signs that we put, whether it's poison, toxic, radioactive, everything has to be labeled. We know blue is for health, red for flammability, yellow for reactivity, white for protective equipment, and then also we rank them 0 to 4. You know, not only we do that, but we actually rank each of the reagents. And not only that, we also can put what kind of protective equipment you want to wear with each reagent when you're handling the reagent. You only want to wear goggles or gloves, coats, and everything. And you can have those charts that help everyone to know what are the protective personnel equipment that you want to wear when you are dealing with certain hazard material. Okay. Again, what is on the material safety data sheets? It's more than we could ask for, really. I mean, it has a lot of information. It identifies the product. It tells us what's the composition, what is the hazard identification, what first aid measures we need to take. I mean, wash, your eyes quickly. I mean, it tells you everything. We don't know it all, and we'll never memorize that. So at least we know that we have the sheet, and we can run to it and identify what we need to do. Firefighting measures, accidental release measure, handling and storage, and then also personnel protection equipment. What kind of personnel protection equipment we need to wear also when we're handling certain reagents. That's all provided to us. And then also it does explain the physical and chemical properties of the reagent or the material that we're dealing with. Ecological information, disposable consideration, transport information, regulatory information, and other information. And we see now a lot in the workplace that you have that all electronically, where you can right away be able to print that. There are databases where you can go to and print everything. You don't have to keep only a binder, but there are a lot of tools where you can access that right online and be able to get that. Okay, so chemical storage. Flammables, you need to store them away from acids and bases. Acids, you need to keep them away from flammable and bases. Bases, you need to keep them away from flammables and acids. So, you have certain storage, you have to segregate them, and you need to watch for what are the storage requirements and where you put your flammable cabinets and so forth, and what you store in them, and how much amount you need to store in them too. There are regulations and guidelines. You cannot use, get all, several, big bottles and you can put them in a small flammable cabinet. There are guidelines of what you can store and not. And one of the good things that only can do good for you is that as we have some QA or coordinators or people in the laboratories that take care of all our QA guidelines, you also can identify a health and safety officer in your department where they can also look at all the health and safety things that you do. They can audit, they can tell you, no, you cannot do that. They are focused on health and safety, and they can work with you in order to make sure that the employees are compliant and the supervisors and the managers are aware of certain hazards that are in the workplace. We find that is very important because you get accountability. People know who to go to if the supervisor or manager is busy, and they can always go into the health and safety. And the health and safety officer in the department can work with your officer also in your institute or in your hospital and can be able to get guidance from them and implement a lot of things in the laboratory that's only going to benefit the employee and the employers. Again, compressed air, there are cylinders. We're moving away a lot of times from the cylinders, and we have the in-house gases now. Nevertheless, if you're using cylinders, you want to make sure that they're secured. They cannot fall and roll. When they're in use, you want to put a sign that says they are in use, and again, they're secured. And then if they're not in use, you want to kind of secure them all together. And then also you want to look at if you're using oxygen that has to be separated from other flammable gases. And again, you want to make sure that the safety starts from the manufacturer, the purchasing, and even when they come to the lab, how we store them, and then how we also dispose them. So it is start from the beginning to the end. It's just a program that touches everyone. And is your waste hazardous? I know a lot of times when we are looking at savings and how we can do that, identifying your waste and segregating your waste can only cause efficiencies and also cost savings for you. So you want to identify, what kind of waste certain containers where you can discard certain things and certain things, and our health and safety department works on that all the time. No, you can discard this in this type of container, and that's not going to cost us as much. So you need to be able to look at that and what waste is hazard and what waste is not hazardous. And then again, if there are toxic waste and harmful or fatal, you want to make sure you segregate that. Also, you want to make sure that, as I mentioned, that the waste is not reactive. You want to be aware of what you're putting. You don't want something to explode because we're just throwing all kinds of things into the waste. And then also, if there's anything that's ignitable, you want to make sure that the waste is not catching fire. And then also, you want to be within the guidelines to make sure that it's not going to ignite or be flammable. And corrosive waste, which can cause damage to skin and body. Those has to be handled with care. And then also any aqueous material which has pH less than 2 or greater than 12.5, you also want to be able to be aware of that. And then mixing waste rule is always that you want to make sure that the listed waste and any mixture of non-hazardous and hazardous, you are aware of that and it's listed on your container. You also want to make sure that the mixture of the hazardous only if mixed with other hazard exhibits some characteristic. And then also when you have a chemical and a biohazard mixed together, the chemical always takes precedence than the biohazard. And then there are other kind of waste, you know, the fluorescent lamps, we know that, mercury in the laboratory, batteries, and other electronic device. Those have different waste containers where we need to dispose them differently. Skip that. Okay, sharp containers. I have to say that's a very sticky issue in our laboratory where we have to make sure that the sharp containers are always closed. You open them, use them, and close them again. You want to get those because, you know, you don't want someone to have something sticking or it's too full and someone did not come and, you know, dispose them, and then someone can get injured on, you know, the sharps that are in the waste container. Leak resistant, puncture resistant, and closable, as I said. Fire extinguishers. Okay, we all have fire extinguishers everywhere. We all know the PASS, which is the pull, aim, squeeze, and sweep. We all get that training. Actually, we invite some firefighters to come in our laboratory every year, and they do the training for us, and it's really a nice thing to see them involved and kind of a community activity where we try to be supportive, and also they support us and our staff. Fire extinguisher, you need to know A, you need to know B for the flammable liquids, you need to know C for electronic, and then also you need to know D for the combustible. So not every extinguisher can be used on everything. So good. I have my 10-minute mark now, and I'm going to lead to the last part of my presentation, which is ergonomics. So hopefully I'm on time. So what's ergonomics? Okay, ergonomic is the study of the relationship between people, task, equipment, and environment, which means that making the workplace fit the worker, okay, not the, you know, the employee fit the workplace. I mean, we have to really do the other way around, and then optimizing human performance. So ergonomics, again, one of the ergonomics that we have, again, is an appropriate design of living and working environment. And it also helps us to avoid the repetitive motion and the injuries that are caused by repetitive motion. So for the work environment, a job task or a design can cause an ergonomic injury. Any of the work methods can do that, but also the lifestyle and the hobbies can cause also ergonomic risk for us. And then personal and medical condition can cause that. So it is a combination, you know, of all that. Like if I'm playing the violin at home or I am playing basketball, I mean, I can just have soft areas, or I can have actually a lot of, you know, some risk. It might not only be caused by work, but it's my lifestyle outside work and my hobbies that I'm doing outside. Okay, so repetitive motion is an ergonomic risk. Awkward posture, static postures, contact pressure, large versus small muscles, forceful exertion, we'll talk about that, and vibration. So really, in order to manage the ergonomic risk, you have to look at the force, the posture, the frequency, and the duration. So if you're doing a task frequently, that can cause an ergonomic risk. The duration, if you're doing a task, but you're doing it for 8 hours a day, that can cause that. The way you're sitting and your posture. And then the forces, the outside forces also. So again, the principles is people have different capabilities. The human body has its own known limitation. Jobs are composed of task demands, and if the demands exceed or greater than the capabilities, then we have a problem. So ergonomic injuries, as I said, there's a trauma disorder, there's a motion injury, the musculoskeletal disorder, which involve the soft tissue, tendons, ligaments, muscle, and nerves, and then there's a long-term exposure due to a repetitive task, and then there's one that's not traumatic, that's not caused by a single incident. So really, if you look at the cumulative trauma, so you have an overuse of something, you know, your arm, your hand, your finger, you start having fatigue, then you start aching, then you start having pain, and then it can develop into a disorder, carpal tunnel or something else. The way to recover is that you want to reduce all that. You want to go the other way in order to be able to recover and reduce all those. So you want to be able to reduce the pain, the ache, the fatigue, but most importantly, the overuse. You still can do your job, but you have to be aware of it and report it early on and be able to do measures before you totally develop that into a disorder. So again, the common musculoskeletal is strain, sprain, tendinitis, and the carpal tunnel. So this is the posture. Anytime you have a different posture than this and you overexert, that becomes a problem. You always want to try to have your hand or your position in a neutral position. You don't want to be doing the scope bending down. You don't want to be doing any task going up. And you don't want to be lifting your arm. You have to have everything in a neutral position. If you're going like that all day, it's going to cause an injury. Okay, so again, longer duration, greater intensity, or a combination of the risk factors. So I wanted to show you some pictures. So let's look at some pictures because I got the 5-minute mark. Okay. Important, take micro breaks. We all have stretch breaks in the lab. We actually have a tone on the hour where it just plays small music, where even if you don't want to go and do a group activity and do stretches, which we do, you can just like sit and maybe focus your eyes on something far away or just do some ergonomic stretches while you're there. But it's a constant reminder for us, you know, I come first and I need to be able to take my stretch break. And job rotations. I know we talk about that, challenges in the lab, but we can make it happen. You know, if you rotate people around, you know, it's easy said than done, but it helps to not to stay in a certain work duty for the longest time. And then also now the ergonomic fitting of the workstations. A lot of examples that how you want to do that. So for example, again, this is the neutral, as I said, you know, where your visual field need to be done. If you're doing usual work, it has to be closer to your body, occasional, a little bit far, and then if there's a far reach, those should be rare duties that you're doing. And you try to avoid to go behind your shoulder line. You can cause an injury. This is a work environment which is not very good. There's a lot of risk factor, a lot of specimen. You don't see a lot of ergonomic conditions there. The seating might not be good. This is a person exerting pressure also, you know, over time that can cause an injury. But if you have the seating correctly, the caster, the foot support, the adjustable is very important. That can avoid that. You want to get all the tools, the footrest, the back support, the lumbar support is all very important. Share rings so your foot is not hanging and you know you have a footrest and so forth. And again, this is the perfect condition. Keep your head upright, minimize the glare on your screen, you know, use a document holder. We all have seen that and all are familiar with that. And then look at padding of your hood so you're not leaning on a hard area where you're gonna start getting pain in your elbow. Use ergonomic hoods, and the most important thing is that you'll be within your reach when you use the biohazard safety hoods. Again, everything within your reach. Take short breaks. On the microscope, I'll show you some pictures. Again, everything is, you know, working here. This is perfect, an ergonomic scope was adjustable. The table is actually adjustable, sitting straight. This is not good. The first picture here is not good. The other person is good, but this person, the arm is hanging a little bit. You don't want that. You want your arm to be sitting. This is good, actually. This is a picture to show you adjustable tables we have. Can be adjusted higher for a person. It can be adjusted lower. And then again, frequent use of supplies within easy reach, pipetting, Again, this is, another person. You want to look at ergonomic and electronic pipettes where it's not, you don't have to exert a lot of pressure to use your pipettes. You want to look at even simple tools where you don't have to manipulate with your hand or apply pressure with your thumb and everything. This is not going to be good. If you cap 100 tubes every day, it's not going to be good. Your thumb is going to start hurting. But if you use a tool maybe to unplug or plug, that might be easier, good technique. There are actually now automation to cap and uncap. We have actually automation in the laboratory right now. This is a poor technique, but if you apply something, will be a better, good technique. Again, capping here. Small hand tools can be helpful. Standing, wearing the right shoes. Again, when you're standing, put some good cushion or padding that will allow you not have your back hurt and so forth. And solution, there are a lot of solutions now. Ergonomic microscopes, and most importantly in the lab now, automation. We have automated harvesting. We have automated metaphase finder. We have, we don't have to analyze on a scope. We can analyze on a station. We actually have automated bending now. So that's why, technology has been, really good to us in the cytogenetics field because it offers us a lot of automation in our field now. And then you want to really participate. As I said, if you're accountable and responsible, you will be able to reduce ergonomic injuries and work as a team and be able to identify all the controls and measures you want to implement in your workplace. Identify problem, risk factor, generate solution, implement and improve, and the most important thing is sustain. That's the most, you can improve a process, but if it goes, down the drains again, it's not going to be good. You need to sustain it. So wanted to just end by this. We created in our institute a green ribbon recognition program. And a green ribbon recognition program is every department will get a green ribbon certificate every month, but we have to pass certain criteria. And the criteria that we have to pass, that we implemented stretch breaks, and we encourage our staff to take their stretch breaks. We notify of any injury or illness or an incident within 24 hours. Even over the weekend, we have to notify about that. Any post-accident, we have to do corrective action, and it has to be completed on time, actually, within, again, 48 hours, we have to do that. We have to have quarterly health and safety inspections, and we have to maintain a minimum score of 95%. And if we have less than that, we don't qualify for our green ribbon. And we have to put a corrective action, and audit results has to be submitted to our health and safety department right away. We have walkthroughs where we identify all the hazards, and the deficiencies have to be corrected within 48 hours. Our health and safety department keep us on our toes, and they just walk around, take a picture, and send it to us, and we have to correct it right away. I'd rather take a picture of the good things, but they do also take the pictures of the deficiencies so we can correct them. And I have to say, a picture is better than 100 words. When I see it, I believe it all the time. New and transferring employees have to have an employee orientation on health and safety, and we have to complete a training checklist. So again, if they're transferring to another department, we have to do it because work conditions, environment, chemical exposure can be different. Reagent audits, our health and safety and us, we do reagent. If we have something not labeled correctly, we get cited for it. And then attendance of the health and safety. Our health and safety department do health and safety monthly meeting for us. We send representative, and they come and have all the information for us in our general lab meetings, and we communicate with the employee that way. So if we meet all that, we get the green ribbon at the end of the month. We post it outside our department, and if we get 12 out of 12, we get recognized for that, a pizza party or something good for the employees and for the department. So it's a great program. It encourages us to stay on our toes and be able to be successful and not injure ourselves. Again, repetitive motion, we have an ergonomic committee goals, which have a checklist and also provided us with training to evaluate the workstations. So we now can do it ourselves. We don't have to rely on someone else. And then training, that's what we're doing today. So we're training, you have to put refresher training, you have an emergency action plan, fire prevention, use of extinguisher, we talk about the bloodborne, respiratory protection, and then chemical specific programs that are specific to your area. You have to have the refresher course every year, and that's, I hope we accomplished that today, and you already received yours, and you can take that and provide it to all your laboratory. And thank you for listening, and hope that covered the 1-hour training for all of you. Thank you.
I didn't mention that Mervat is our president-elect. So,
Good to see you. Thank you. Thank you very much. Thank you all.